Aloha, welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper. Today I will be demonstrating the self-myofascial release and muscle energy techniques for the levator scapula. For today's techniques, you're going to require the following tools: a lacrosse ball or ball of similar density, a self-myofascial release stick or massage stick, and a flat wall. The levator scapula is a muscle that attaches near the transverse processes of the cervical vertebrae and travels inferior or down towards the upper middle corner of the shoulder blade, also known as the superior angle of the scapula. When this muscle is dysfunctional, it may contribute to an elevated shoulder on the affected side. It may also contribute to painful restricted rotation and lateral flexion away from the affected side. If this muscle has myofascial trigger points, it may cause a referral pain pattern that travels up the lateral aspect of the neck over the ear, settling into the temple or the upper jaw area. To achieve the myofascial component of this technique, we are going to apply continuous force through the lacrosse ball into the levator scapula and the fascia in that area for 1 to 2 minutes. To achieve the ischemic compression component of this technique, we are going to locate tender areas or myofascial trigger points and apply force to these tender areas through the ball for 20 to 30 seconds. Within this time, the discomfort or pain should become less intense, and that's kind of what we're looking for before moving to another tender area. Once you have treated 2 to 4 tender areas, you should have applied direct compression into the fascia in this area for 1 to 2 minutes. For the first component of this technique, we are going to apply force into the lower trigger point of the levator scapula and the fascia in that area using the lacrosse ball and the flat wall. As you're performing this technique, the ball tends to climb the wall. So what I'm going to do is I'm going to get into what's called a wall squat, where I lean into the wall, and I'm going to slide down the wall about 1/4 of the way so that I'm in a quarter squat. With the opposite arm, I'm going to take the ball and I'm going to place it right where the muscle attaches to the upper middle corner of the shoulder blade. I'm going to lean back using the force from my legs to find the trigger point where the muscle attaches to the shoulder blade. As you're looking for it, you may hear a popping or a crunching sound. But once you find it, you want to apply continuous force to that area with the ball. You want to avoid grinding. That is one of the bigger mistakes when people perform this technique, is to grind the ball left and right. You want to avoid doing that to the trigger points because you may increase the tenderness in that area by increasing the inflammation of the trigger point. So once you find these tender spots, you want to lean into them for 20 or 30 seconds. And once you've met that time requirement and the discomfort has become less tender, you want to move the ball and change your angle and find another tender area. And once you've done that, you want to lean into that one for another 20 to 30 seconds. To perform the second component of this technique, we are going to address the trigger points and the fascia in the upper portion or cervical part of this muscle using the myofascial stick. We're just going to take the stick and we're going to place it behind the head, and we are going to turn the head and rotate it towards the dysfunctional side, basically trying to look at the hand that's holding the stick on the same side that we are treating. We're going to apply a forward or an anterior force by pulling the stick into the cervical area. And we're going to look for trigger points by rolling the stick until we find an area of tenderness. Once you locate that area of tenderness, we're going to apply continuous direct pressure into that trigger point for 20 or 30 seconds. At that time, we'll continue to roll and look for another area of tenderness. And once you've found that area of tenderness, we are going to apply continuous force through the stick into that trigger point for 20 to 30 seconds. To perform the muscle energy technique for the levator scapula, we are going to secure the wrist on the affected side behind the back with the free hand, pulling down and away on the shoulder, creating a stretch on the levator scapula. To finish the stretching motion, we're going to look down and away towards the same side that we pulled the hand, so that we have a stretch in the upper portion of this cervical area. We are going to hold this barrier for about 10 seconds, allowing gravity to do the stretching motion. At about the 10-second mark, we're going to use the free hand to block off the back lateral side of the head, making sure not to pull with the hand, but just create a blocking motion. We're going to use the cervical muscles to try to return the head back to neutral while preventing that motion with the free hand for 5 to 10 seconds. Once you've met the time requirement, we're going to allow gravity to help pull the head down and away, creating a bigger stretch. We're going to hold this new position or new barrier for 10 to 20 seconds. After you've met the time requirement, we're going to use the free hand again to block off the head and use the cervical muscles to try to return the head to normal or neutral position. And after about 5 to 10 seconds, we are going to release the head and allow gravity to continue the stretching motion for another 10 to 20 seconds. You want to repeat this process about 5 to 6 times.